Welcome, ladies and gentlemen, to the Senior Blood Pressure Tips channel. Today, I will share about extremely important vitamins that help the elderly control blood pressure effectively. Supplementing the right vitamins not only helps stabilize blood pressure, but also supports the heart and improves overall health. So what vitamins should be prioritized? Please follow along. 1. Vitamin D stabilizes blood pressure by regulating the vascular and nervous systems. Vitamin D is an essential micronutrient that not only helps keep bones strong, but also plays an important role in regulating blood pressure. According to clinical studies, vitamin D deficiency is associated with increased activity of the renin-angiotensin system, the system that controls blood pressure in the body. Overactivation of this system can lead to vasoconstriction and increased blood pressure. Vitamin D also has the effect of dilating blood vessels by regulating intracellular calcium concentrations in vascular smooth muscle cells. Thanks to that, blood vessels are softer and blood pressure is also significantly reduced. In addition, vitamin D supports the function of the endothelium, the layer of cells that lines the inside of blood vessels. Helps maintain elasticity and stability of the circulatory system. For the elderly, vitamin D should be supplemented through sunbathe in the morning for 15-20 minutes every day before 9 a.m. to help your body synthesize natural vitamin D through your skin. Supplement foods like salmon, egg yolks, milk, and cereals fortified with vitamin D. Or use vitamin D3 tablets, mainly D3-cholecalciferol, as prescribed by your doctor if there are signs of severe deficiency. Maintaining ideal blood levels of vitamin D around 30-50 ng or mol will help support more natural and sustainable blood pressure control in the elderly. 2. Vitamin C enhances blood vessel function thanks to its powerful antioxidant properties. Vitamin C ascorbic acid is one of the most important natural antioxidants in the body. It helps neutralize free radicals, molecules that damage cells, thereby reducing chronic inflammation in the vascular system. One of the main mechanisms by which blood pressure increases is oxidative stress and vascular endothelial inflammation. Vitamin C helps to overcome this condition by protecting the endothelium. Capital is very important in regulating vasodilation and maintaining stable blood pressure. In addition, vitamin C also stimulates collagen synthesis, helping to maintain the structure and elasticity of blood vessels. Essential element to combat arteriosclerosis in old age. Some studies show that vitamin C supplementation can help reduce systolic blood pressure by about 3-5 mmHg in people with high blood pressure, especially when combined with a diet rich in fruits and vegetables and a healthy lifestyle. Food sources rich in vitamin C. Fruits like oranges, grapefruit, kiwi, strawberries, guava. Green vegetables like broccoli, spinach, red bell peppers, kale. Root vegetables like potatoes, tomatoes. Older adults should supplement about 75-90 mg of vitamin C per day through fresh foods or supplements if needed. Avoid high doses as it can cause digestive upset. 3. Vitamin B6 reduces homocysteine levels, protects blood vessels, and helps stabilize blood pressure. Vitamin B6, also known as pyridoxine, is an essential micronutrient involved in more than 100 enzyme reactions in the body, especially protein and amino acid metabolism. One of B6's most important roles related to blood pressure is its ability to regulate homocysteine levels in the blood. Homocysteine is an intermediate amino acid in methionine metabolism. When homocysteine levels become elevated, often due to a deficiency of vitamin B6, B12, or folate, it can damage the lining of blood vessels, stimulates inflammation, and promotes atherosclerosis, thereby increasing the risk of high blood pressure and cardiovascular disease. Adequate vitamin B6 supplementation helps reduce homocysteine to safe levels, protecting the flexibility of blood vessel walls. Supports blood circulation and stabilizes blood pressure, especially beneficial for the elderly. Food sources rich in vitamin B6 include ripe banana, potatoes, especially baked potatoes, salmon, tuna, chicken breast, sunflower seeds, and nuts. If diet is inadequate, the elderly can supplement vitamin B6 through single tablets or B-complex form, with dosage recommended by nutritionist or doctor, usually 1.5–2 mg or day for older adults. Note: long-term abuse of high doses of B6 over 100 mg or day can cause peripheral nerve damage. Therefore, supplementation requires professional guidance. 4. Vitamin B12 creates healthy red blood cells, reduces cardiovascular risk, and helps control blood pressure. Vitamin B12, also known as cobalamin, is an essential micronutrient that plays a particularly important role in blood formation, maintain the nervous system, and protect cardiovascular health, especially in the elderly. Vitamin B12 deficiency can cause megaloblastic anemia caused by the bone marrow not making enough mature red blood cells. This condition causes the heart to work harder to transport oxygen, increasing stress on the cardiovascular system and possibly contributing to high blood pressure. In addition, like vitamin B6, B12 also participates in the metabolism of homocysteine, an amino acid directly related to atherosclerosis. High homocysteine levels are a risk factor for vascular damage, heart failure, and high blood pressure. Food sources rich in vitamin B12 include eggs, especially yolks, milk and dairy products, yogurt, cheese, fish, salmon, mackerel, tuna, lean meat, beef, chicken, animal liver rich in B12, but should be eaten in moderation due to cholesterol. For the elderly with absorption problems due to decreased stomach acid or vegetarians, consider supplementing B12 by pill or injection under the direction of a doctor. The recommended dose for older adults is usually 2.4 micrograms day, but higher doses may be needed if absorption is poor. Note: prolonged vitamin B12 deficiency not only affects blood pressure, but also causes irreversible nerve damage, so it needs to be detected and supplemented promptly. 5. Vitamin E, strong antioxidant, protects blood vessels and cardiovascular system in the elderly. Vitamin E is a group of fat-soluble compounds, most notably alpha-tocopherol. Plays a major role in fighting free radicals, thereby protecting cells, especially blood vessel and heart cells. Free radicals are byproducts of metabolism. If they accumulate in excess, they can damage blood vessel walls. Increases the risk of atherosclerosis, a major factor leading to high blood pressure and cardiovascular disease. Vitamin E helps maintain blood vessel elasticity, improves blood circulation, and reduces systemic inflammation, which is very important for older adults with high blood pressure. Food sources rich in vitamin E include nuts such as almonds, sunflower seeds, walnuts, vegetable oils such as olive oil, sunflower oil, avocado, spinach, pumpkin, salmon, and mackerel. Elderly people can supplement vitamin E through their daily diet. However, vitamin E supplements should not be abused, because prolonged use of high doses can increase the risk of bleeding or interact with anticoagulants. The recommended safe dose for older adults is about 15 mg or day 22 IU. Conclusion: supplementing the right vitamins helps the elderly not only control blood pressure, but also prevent many dangerous complications. However, remember to take supplements as directed by your doctor and avoid taking high doses on your own. If you find this video useful, please click like, subscribe, and share it with your loved ones. See you in the next senior blood pressure tips video.